Phonetics. Part 3. Organs of speech. We have already learned that phonetics is a branch of science and deals with sounds. Language is made up of sounds. We do not use sign language to communicate with one another. We speak, and sound is very essential for speaking. But these sounds are not random. It is an organized pattern of sound. There may be similar sounds in many languages, but that does not mean the same in every language. For example, means in Hindi it is mango. In Tamil means yes, and in English means hand. So in all these three cases the same sound is there, but the meaning differs in these three languages. That is the same with every language also. Now let us move on to the organs which are needed to speak. Okay. The speech sounds. We use our body organs from head to abdomen for speech, brain for processing, ears for hearing, and so on. And some organs produce speech sounds. Tongue, nose, lips, teeth, etc. help in producing sounds, and so they are called organs of speech. So, the lips, it is used, both the upper lip and the lower lip is used. Then the teeth, the upper part of the mouth, it is called the roof, the curve or the arch in our mouth is called as the hard palate. And when you touch with your tongue, you will find after the hard palate, there is a soft tissue also there that is called as the velum. And in Tamil we say ulnaku, that is called as the uvula. This uvula acts as a valve. Either the air passes through the nasal cavity or it passes through the mouth. So that is very important when we speak. For example, when we say sounds like ma, na, nya. When we speak sounds like that, what happens is the air that comes out from the lungs passes through the larynx and it goes through the nose. It does not go through the mouth. When the air passes through the mouth, it is called as oral passage. And then the tongue. When we speak, what happens is the tongue is not in its rest position. The tongue moves up and down. It touches some part of the mouth or the other. And this happens only when consonant sounds are produced. Only when the vowel sound is produced, the tongue does not touch any part. Now this is the mouth. The soft palate is shown here and the uvula is shown here. This uvula is the valve, and when this uvula moves, the soft palate also moves slightly. Then the tongue, and then the teeth. The teeth which joins with the gums is called as the gingiva. It is the outer part of the gums. And when you take the upper row, what happens is the upper row of the teeth joins with the inner part of the mouth, that is the hard palate. This is another picture to show you hard palate, tongue, then the air that is passing out through the larynx and it goes through the nose. Now, when we speak, what happens is the tissues in our throat, the glottis. We say that the Adam's apple, the protruding bone in our throat. This bone has some tissues, elastic tissues, so that it moves and comes back to its position. Such tissues are there in the glottis. So the first picture shows you vocal cords in fully open position. This position is there when we use for our normal breathing, when we inhale air and when we exhale air. And then the second one, vocal cords in closed position. In this, what happens is the air does not pass out. This is a type of stricture. And then vocal cords, when it is in fully open position, it tries to come in contact with each other. So it is attempting to come to close position. So what happens is this vocal cords, they are the elastic tissues in the larynx, and this helps also in producing speech sounds. So when this vocal cords are in open position, okay, it is called as glottis open, and when it is in closed position, then it is called as glottis closed. So what happens is when the air comes from the lungs, it forces its way through the glottis and it causes some sort of vibration in the throat. Okay, sounds that are produced when the vocal cords are brought together, when both the sides come together, they are called as voiced sound. Okay, and some sounds may be voiced and some sounds may be voiceless. So this can be felt by placing the finger on the Adam's apple. When pronouncing a sound, what happens is when we hear a buzzing sound, like a bee buzzing, or a hissing sound. Okay, when it is a hissing sound, it is voiceless, and when it is the buzzing sound, it is voiced. Okay, so mostly what happens is when the position is open, when the position is closed, we saw that it will be a voiced sound. So when the position is open, when the vocal cords are open, it will be a voiceless sound. So in English, all the vowels and nasals are voiced. Other consonant sounds except nasals, they are voiced and some are not. So here, for example, nasals comes under consonant, so it is voiced, and the others come under voiceless sounds. Now, let us see about the teeth. Now, when you go to a dental clinic, you say you want to see about your teeth. You have a decayed tooth or something, you want to pull it out, or you want to find some remedy for your pain, you go and see a dentist. So, keep in memory about a dentist. So, we are going to see about the teeth. You got the upper as well as the lower incisors. The reddish color, that is the tongue. The curved top, that is the arch-like position in the diagram, that is the hard palate. The yellow one is the teeth. What happens is the upper part of the teeth touches the hard palate, or it joins with the hard palate. That part is called as the ridge, teeth ridge. Okay. So what happens is this teeth ridge, or it is also called as alveolar ridge. Okay, and what happens is when we speak certain sounds, we have to touch the teeth. For example, the blade of the tongue comes in contact with the inner surface of the upper incisors, not the lower row of teeth, the upper row of the teeth, for producing sounds. For example, thanks, father. In thanks and father, th only is there, but in thanks it is their pronunciation, and in father it is their pronunciation. Okay, so whether it is for their or their, the tongue goes and touches the inner part of the upper incisors. Such sounds are called as dental sounds. And what happens is when the tongue goes and touches the alveolar ridge, I told you the part that joins the teeth, upper row, and the hard palate, that is called as the alveolar ridge. So what happens is when the tongue goes and touches that part, then it is called as alveolars. Okay, such sounds are called as alveolars. For example, tame, dame, nut, lake, sun, zoo are produced. Palate. Already told you. Hard palate, soft palate. The soft palate is called as the velum. Okay. And the hard palate. When you touch with your tongue, you can find out the difference between the hard palate and the soft palate. the front part of the curvy part, that will be a little rougher than the back side. Okay, and then what happens is the velum. So it can be raised or lowered, but it cannot be raised or lowered like the tongue. The tongue is the most flexible part of the mouth. Okay, what happens is when the uvula moves, this also moves slightly and so acts as a valve enclosing and opening the nasal passage of the air. So when the soft palate is raised, what happens is when the air comes from the lungs through the windpipe, it enters through the oral passage, that is through the mouth, and sounds are produced during this time are called as oral sounds. When the soft palate is lower, that is when the uvula acts as a valve and it blocks the mouth passage, the air passes through the nose. Okay, and so that is called as nasal sounds. If we close our lips at this time, the oral passage is closed. Sometimes we say people, மூக்கால பேசலாம், because the air passes through the nose, not through the mouth. When we speak continuously, what happens is air passes through our mouth and not through our nose. Only for nasal sounds we use that. So through this diagram you can find out nasal articulation. The first one, see, the arrow mark is given. The air passes, that comes out from the lungs, it goes to the throat and it goes through the nose passage. If you keep your mouth also shut, what happens is air will not pass out. Here, if it is even if there is a slight opening, also the air can pass through the mouth. In the second diagram, you can see that the air passes only through the mouth and here the valve is closed. In the first diagram, the arrow mark, you can see the valve is open. This is the position of the soft palate. Okay? Now, nasal sounds is said ma, na and nya. So, this position is used for humming and breathing. Okay, normally we say when we hum, we do not open our mouth. We only keep our lips tightly closed. Okay, so only during this humming and breathing, we close our mouth and so the air passes through the nose. Okay, so these nasal vowels are heard in French words. So, enfant, bon. So what happens is when you say bon, though you open the mouth, the air passes only through the nose. Okay, now I told you the most flexible part in the mouth is the tongue. You can move it forward, you can move it backward, upwards and sideways. Okay, and it can touch any part of your mouth. During the production of vowels, the tongue plays a very important role. So when we pronounce vowels, we will see to the height of the tongue, the part of the tongue, what part of the tongue is used also is seen. That is why it is very important in the production of vowel sounds. So it is raised towards the palate or lower, but it does not touch any part within the mouth when we pronounce or produce vowel sounds. If it touches or it rubs any part of the mouth, then it will be only a consonant sound and not a vowel sound. Okay, here this diagram is there. The tip of the tongue you can see, nuninaku. Okay, and then the blade, the outer part, fully. And then the tongue is divided into three: the front, center, and the back part. Okay, and again the root, which joins with the throat part. Okay, so for vowel classification we need the front, center and the back part. Now let us come to the lips. Lips also play an important role when we produce vowel sounds. Okay, so the quality of the vowel changes according to the position of the lips. There are four positions for lips: either it is close rounded, open rounded, spread, or it is neutral. So when we say woo, fool, we can find that the mouth is or the lips are close rounded. When we say ah, as in fought. Then we find it is open rounded. When we say pen, it is neuter. When we say bean, it is spread. So like that we find out the position of the lips. So now we have seen that we have lips, then the teeth ridge, palate and the alveolar, then the glottis, the nose, the velar. All these parts are used for producing speech sound. Okay. Now, let us see how should we call these as the organs of speech and the sounds produced. So when we use lips, we should call the sound as labials. When both the lips and teeth are used, it is labiodental. If the lips, both the upper lips and the lower lips are used, it is bilabials. Okay. Then teeth, it is dentals. Teeth ridge, alveolus. Palate, palatals. Palate and alveolar, that is the alveolar ridge. Okay, then that is called as palate alveolar. Glottis, that is from the throat, from the vocal cords. When you say ha, the sound comes from the throat and not from the mouth. Then the nose, nasals, velum, velar. So all these are the organs of speech that are highlighted in dark pink, and then the sounds produced are called as labials, labiodentals, dentals, alveolus, palatals, palate alveolar, glottal, nasals, and velar. And this classification is specially only for consonant sounds. We do not classify the vowel sounds according to the organs of speech. Okay. So I hope you understood it. Please go through this video at least twice or thrice so that you will know more about it. Thank you.